Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis. We give credit to Professor Stephanie Lucas and Terry Walholick for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts, our guests, and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Today, we welcome 5 of the pharmacy school students with their podcast entitled Dose of Knowledge, in the Classroom and Beyond.
What's up, everyone? Welcome back to the Dose of Knowledge podcast. Today's episode is called In and Beyond the Classroom. We are your hosts, Aniston,
Kennedy, Avery, Sarah, and Danielle. We are students at St. Louis College of Pharmacy and are here to inform you on all things pharmacy school and how prepared you will be to make a difference in healthcare.
Hey, everyone. Before pharmacy school, when you thought of a pharmacist, what came to mind?
Before starting pharmacy school, when I thought of a pharmacist, the first thing that came to mind was the pharmacist behind the counter at Walmart.
I thought a pharmacist was someone who was basically just double-checking the doctor.
For you all listening at home, is it the person at your local pharmacy standing behind the counter? Or maybe is it someone working behind the scenes in a hospital? Now, when you think of the education needed to become a pharmacist, what do you think of?
Now that I'm in pharmacy school, I think of a pharmacist as a true medication expert. While learning about all the different disease states and conditions, we are also responsible for knowing so much about medications needed for treatment. We need to know how they work in the body, but we also need to know how different drugs work together or even against each other.
Prior to attending pharmacy school, I never imagined it would take 7 years of school to become such a vital role of the healthcare field. Pharmacists not only have to go through the difficult classes for these years, but also do real-world experiences to get clinical hours.
To get started, we're going to discuss all the different aspects of the pharmacy curriculum. Then we will jump into the different services that pharmacists are able to offer with their education. We will also be hearing some insights from specialty pharmacists about their experiences in pharmacy school and how that prepared them for their roles now. All right, let's get into it.
First, we would like to tell everyone what it takes to become a pharmacist and how pharmacy school works. We understand that not all of you may know what all is included in pharmacy school. Once you are accepted into a pharmacy school program, either based on a previous bachelor's degree or by obtaining all of the required courses, you'll have 4 years of professional schooling. In total, students will experience either 6 or 7 years of college courses, depending on the path chosen. For example, I personally am on the 6-year path as I did some college courses while I was in high school, so that put me ahead of the game a little bit. Getting a bachelor's degree is completely optional, and that is a decision that the students have to make for themselves, as it does require some extra classes on top of the coursework you are already enrolled in. For me personally, I decided to get my bachelor's degree in health sciences, but that is going to be used as a backup for me if I were to ever need it.
The biggest part of the time spent in pharmacy school will be spent in the didactic curriculum, which takes place just in the classroom. This contains integrated pharmacotherapy courses. These courses are grouped by body system in order to teach students about the disease states associated with each body system, along with the treatments for each of these diseases. Treatments taught include not only prescription medication, but also over-the-counter products that may be available, as well as self-care measures that the patient can use to improve their overall health and diminish the risk of complications from the diseases. Although it may not be the first thing that comes to mind when we think about pharmacists are often the ones making recommendations to patients who wander into the pharmacy looking for something to get better without having to go to the doctor, or maybe even the person the doctor might ask to make recommendations in the hospital setting. The product recommendations that pharmacists are taught in school are essential for helping these patients. It is also essential to know when matters are too serious to be treated with over-the-counter products and to inform the patient that they need to see a doctor. It is important to remember that pharmacists go to school to become medication experts and to be able to make recommendations to patients, doctors, and make sure that a patient's new therapy won't result in adverse effects. Avery, what pharmacotherapy course has been your favorite so far?
I really enjoyed pulmonology, or the study of the lungs and different breathing disorders. This was the first pharmacy course where I really felt like I knew how to assess and treat different disease states, and that was super exciting for me. For me, it's so much easier to care about and learn in a course when I feel like it is truly going to benefit me when it comes to treating patients.
And Kennedy, which one are you looking forward to the most?
I'm looking forward to learning about oncology in the curriculum, as when I started pharmacy, my idea was to work with patients with cancer. I think the different studies of cancer are so interesting, as it is always changing and there are so many research opportunities for now and in the future. A lot of things that we learn are cut and dry medications and disease states, but oncology is completely different disease states that we can never learn enough about.
There are also other classes in the pharmacy curriculum that are not as strenuous and into the details about the dosing of medications and treatment of diseases as those integrated pharmacotherapy courses. There's pharmaceutics, where we learn how drugs are made and the process to getting new drugs made. And in immunology, we learn how the body fights illnesses. There's also pharmacy calculations, which teaches us how to use different strengths of drugs to get the dose needed and how to calculate patients' ideal body weight and body mass index. An important class that is taken during the first semester of pharmacy school is evidence-based medicine. In this class, we learn how to use different websites and databases to get information on the latest research or find answers to questions that may not have been taught in school or any information that could have been forgotten. When discussing evidence-based medicine, Siteman Cancer Center's Assistant Pharmacy Director, Evan Strachey, said, "As a pharmacist, you're expected to know and be an expert in a wide variety of medications and disease states. Retaining all that to memorization is not realistic. This course teaches you how to utilize your resources. At Siteman, the practices cannot be defined by textbooks or guidelines. Knowing where to find this information to apply to patient-specific care is critical in the treatment of patients in this critical setting." There are some additional classes that must be taken, but we get to choose those, and these are the electives. There's a wide variety of options to choose from, depending on your personal interests. Sarah, what's your favorite elective been so far?
So far, I really enjoyed the virology elective. Virology is the study of viruses, and I have found it very interesting to learn not only about the common viruses that make people sick every day, but also about viruses that are not as common, some which have even caused massive outbreaks and pandemics.
Anson, I know you've taken several different electives. What's your favorite you've taken so far?
So I personally have two that are up there, one being medicinal herbs. I really love this course, as when we all think of pharmacy, we generally think about behind the counter, but what about the medications we use day to day? This includes supplements, vitamins, herbals, etc. This course went into the why behind how all of these popular and well-known medications worked. An example would be herbs ranging from elderberry and honey to marijuana.
Yeah, and those details into the medicinal herbs are something we actually are not required to know as many details about the herbal medicines as other countries. So that's a great elective to be offered in case someone wants to learn more about it.
Another class that I'm currently really enjoying is Intro to Residency. This class prepares you for post-grad training. Small plug, residency is discussed in another episode by our peers, and how you can set yourself apart from others in the application process. The assignments in this class consist of creating a CV and a letter of intent, which will be very useful in the future for not only residency, but also any job position that you're applying for.
Information about these courses and other courses taken throughout the pharmacy school can be found in the pharmacy curriculum in the show notes.
All right, let's get into the fun, hands-on stuff. College starts a sequence of 5 skills labs, and these start in your second semester of professional school. Hey, Aniston, what part of skills lab do you like the most? I personally really enjoyed, like you said, the hands-on learning and patient communication practice opportunities. For example, this recent Skills Lab 2, we had a unit on inhalers that lined up with our pulmonology course. We were able to use the information we were learning in pulmonology, then learn how to counsel a patient on the correct use of the inhaler in Skills Lab. Counseling is crucial in pharmacist roles, as medication is only as effective when used properly. To demonstrate understanding of this skill, we had a practicum, or an OSCE, which is another abbreviation standing for Objective Structured Clinical Exam, which is where fourth-year pharmacy students would play the patient role, and then we, as P2 students, would demonstrate the pharmacist counseling role. Yeah, medication counseling is one of the critical skills you learn in pharmacy school. It can also be known as medication reconciliation. This is a service that many community pharmacies offer, as well as other healthcare systems. The counseling consists of talking about all the medications that a patient is taking to make sure that the pharmacy has an accurate list, and then we can possibly evaluate if these medications are benefiting the patient. During this review, pharmacists can work with patients to make sure they understand what each of their medications are for, as well as how to take them. The first intense therapeutics class that we take in pharmacy school is during your second professional year. You learn about pulmonology, which is the study of the lungs. As you learn about different medications and inhalers through this course, you're introduced to the physical inhalers themselves in Skills Lab.
You learn how to use them, and you'll learn how to counsel patients about how they should be using them and what effects they can have from these medications. Following pulmonology, we have the cardiology course, which is the study of the heart. Skills Lab follows this sequence as well. You will learn how to take blood pressure manually and how to counsel your patients on their blood pressure goals based on their medical history. Also, you will teach them how they can monitor their blood pressure at home. During your third professional year, you have a skills lab dedicated to sterile compounding. This is the class that will make you feel like a real scientist. Sterile compounding is used to make IVs that you see in the hospital. As Site and Cancer Center only makes infusions all day long, Dr. Evan Strachey is very passionate about this class. He says, building off of an experience that you learn in pharmacy school, sterile compounding is a core skill that you're taught. You learn this in your P3 year, and going into this lab with the experience allows you to make a connection with the real world. Sterile compounding is a difficult skill to learn with all the different manipulations and steps you have to remember, but it makes you feel really cool when you get it down. During the second part of your P3 year, you learn how to prick people's fingers to take their blood glucose levels, and you can also teach the patients how they can take their own and how to document for their doctors. You also learn about different physical tests you need to do on patients to assess their diabetes.
Another learning experience we get to have in pharmacy school is interprofessional education. These experiences take place outside the classroom to allow students to practice their learned skills with members in the community. This includes one-on-one experiences with patients, as well as community education experiences in the public. We have already done several of these, including having seminars with other health professionals like nursing, physical therapy, and medical students to learn how to work in a team in the medical world, and teaching kids at the Science Center here in St. Louis about pharmacy. Telling the kids about pharmacy really helps us learn how to phrase things in simple terms so that the kids understand, which is an important skill for us to have when talking to patients.
Another aspect that we go through in pharmacy school is called co-curricular education. This time is set aside to house education pieces that do not fit elsewhere in the curriculum, and this will include vaccine administration training and an opportunity to learn more about specific careers you may be interested in. Dr. Ariane McGillivray, a clinical pharmacist at St. Joseph, St. Charles, and a long-acting injection pharmacist at St. Joseph, Wentzville, shows that in-school immunization practice allowed her to feel more comfortable when administering long-acting injections and immunizations throughout her rotations. Throughout the curriculum, there are multiple opportunities to practice with classmates to get a comfortable feeling of the syringe. Going into more detail about vaccine administration, where we're certified through the American Pharmacists Association. This critical skill learned by pharmacists has allowed vaccines to become more accessible to patients. Recent legislative changes in the state of Missouri have given the authority to pharmacists to order and administer vaccines without a provider's prescription. Because there has been a shift in this process, vaccines have become far more accessible to patients. According to the National Association of Chain Drugstores, up to 90% of Americans live within 5 miles of a pharmacy. Many patients often find it more difficult and expensive to go to the doctor to get these vaccines versus getting them at the pharmacy while they are already there to get their medications.
There's something we here at pharmacy school like to call IPPEs, which are Introductory Pharmacy Practice Experiences. An IPPE is a 3-week, 120-hour experience between the summer of your first and second year, as well as in between your second and third year of pharmacy school. These opportunities take place in either a community pharmacy or a health system pharmacy, like Mercy, SSM, Barnes, and so on. IPPEs, per Dr. Ariane McGillivray, teach students how to learn. It provides students with the opportunity to interact with various healthcare professionals as well as the patients who seek pharmacy services. Many students have some sort of pharmacy experience when entering pharmacy school, whether that be in a hospital or a community setting. An IPPE allows students to see the other side that they may not have had exposure to. Dr. McGillivray highlights a certain finesse that is learned through experiences on how to properly make suggestions to physicians and share your knowledge. Everyone here has gone through our first community experience. Kennedy, what was yours like?
I actually trained at an independent pharmacy that focused more on the financial side of owning the pharmacy, and we talked about the different state programs that they participated in to bring in more money for the pharmacy.
What about you, Sarah?
My experience allowed me to see that even in community pharmacy, there are still so many options for a career. My community rotation took place in a pharmacy that also had a long-term care side where they could fill medications for nursing homes and other facilities. Being able to spend time in this pharmacy that had a traditional community pharmacy as well as a long-term care portion was super interesting and showed me that even within community pharmacy, there's so many options for different career paths.
For me personally, my favorite experience throughout my IPPE was administering long-acting injections, to patients who are diagnosed with mental disorders, and this is specifically schizophrenia and bipolar disorder.
Next, I want to touch on internships. Internships can be paid or unpaid and can offer key experiences that may aid students in learning more about the career path that they one day want to pursue. For example, many students become interns within a community pharmacy or a hospital setting. For me personally, I work at Barnes Jewish Hospital as a pharmacy intern, which is where I get paid to work alongside clinical pharmacists. I think this is an excellent opportunity for students, as I am able to make some money while still in school, but I'm also being exposed to my future career path earlier than others.
All right, another acronym here in pharmacy school after IPPEs is APPEs. APPEs are advanced pharmacy practice experiences for students in their last year of pharmacy school. APPEs start in May at the end of your third professional year and go on until May when students graduate. There are 8 different experiences that students get to practice in, ranging from community pharmacy, health system, mail order, and any additional elective that students have in a desired area. Each experience consists of 200 hours and lasts 5 weeks each. Students do get an off-mod or off-module, which allows some free time and final board exam studying. Dr. Ariane McGillivray expresses that APPEs give you time to further gain exposure in fields that may interest you. Danielle, what are you looking forward to?
I'm looking forward to hopefully getting a rotation at a Veterans Affairs hospital because pharmacists working in this setting can have more of an input into the patient care process than a pharmacist in a regular hospital or in a Walgreens would. In this setting, you can refill a prescription or change the patient's prescription without having to get a new script from the doctor like you normally would.
What about you, Avery?
I'm interested in becoming a pharmacist in either the emergency department or in an intensive care setting. With this in mind, I'm most excited for doing a critical care or emergency medicine rotation. For me, I want to get the most out of my rotations and really expose myself to all the different career paths there are out there, even if they may be more difficult.
So like I said earlier, my IPPE was with long-acting injections, which is in the psychiatric field. So I look forward to scheduling psychiatric and industry-related rotations because that's something I feel I will be interested in. My long-term goal for me would be to end up in a position where I can be part of the process of making and putting out antipsychotic medications into the market. Getting an APPE position at a drug company that produces these medications would be the equivalent of a 5-week interview, as many APPE students come back to get hired on. P.S. This is also something heavily discussed in our Intro to Residency course.
Some other things to expect in pharmacy school are a heavy workload and working in a fast-paced environment. Being in pharmacy school is like a full-time job, and although students are responsible for a multitude of things, many still find the time to hold jobs as well as participate in extracurricular activities. In our experience with pharmacy school, we have found that the staff are overwhelmingly supportive and willing to help you at any step of the way to see you succeed. All you have to do is ask and be willing to learn. Aniston, what are some things that you have made time for outside of school that you are passionate about?
So I'm a bookworm. I love reading, and it is not uncommon at all that if I'm not studying, I'm spending approximately the whole entire day reading one or multiple books. I also enjoy my animals with my whole heart, so anything revolving around them brings me joy. Lastly, I'm a music connoisseur, and I will take any opportunity to see my favorite artist in concert or just stare at their lyrics on my Spotify.
And what about you, Kennedy?
Since starting school, I have morphed into a cat mother. I started with one just to have a companion, and before I knew it, I now have 3 in total, and I would do anything for them. My youngest child, Colby, is the biggest cuddle bug, and this year we have been deeply invested in Law & Order SVU. I watch it even while I study lately. It takes the edge off the stress. I have also gotten deeply invested in some murder podcasts on Spotify. I enjoy listening to those while I study as well.
And what about you, Avery?
Well, as if I didn't have enough to deal with, I just recently got an 8-week-old mini golden doodle, and his name is Maverick. So I enjoy spending time with him, and I find that he does bring me a lot of stress relief when I've had a long day at school. Woo! I know that was a lot. We discussed the education and curriculum in pharmacy school and what your next few years will look like, should you decide to join this field. While the workload may be daunting, the payoff of knowledge and experience is well worth it. There are so many fields of pharmacy to go into and opportunities to find your perfect match. So ask yourself, what are you looking forward to in your pharmacy career? Whatever it may be, we hope you consider St. Louis College of Pharmacy to aid in your pharmacy journey.
Thank you, students, for hosting the podcast today, and thank you, listeners, for joining us today. Please share this episode with your friends and social media outlets, and seek out the other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found in your favorite podcast channel.